My name is Dr. Paul Garlich. I'm the facial plastic surgeon at Garlich Facial Plastic Surgery. I've been practicing now for over a decade in Gainesville and Brazelton. My training initially started at the Georgetown University Hospital in head and neck surgery, and I followed this with a one-year fellowship through the American Academy of Facial Plastic Surgery, and I'm board certified in both head and neck surgery as well as facial plastic surgery. Our faces are how we communicate. The complexity and anatomy of our face is what drew me into this field initially. And I believe my practice actually helps to optimize people in how they communicate day to day. This is going to sound a little cliched, but I think we would all agree that beauty is within. You can have a child with protruding ears, or somebody with a disfigurement from trauma or cancer, or somebody with a crooked nose. I think these external features that sometimes will weigh on an individual's mind will actually stifle them. So what I look to do is to unburden them of these particular worries or concerns. And much like a family practitioner does not create health, but rather promotes health, my job is not to somehow create beauty, but it's just to help promote someone's inherent beauty. I love music, and the beauty of music is often in what notes are not played. We've all seen the patients that have had too much of an injection or too much surgery. More is not always better. Often my job is just to educate patients that less can be more.
So the procedure that I had done at Garlich Facial Plastics was rhinoplasty, and he also did some things to help me breathe better as well. He offered so many statistics and so much science to the process that it really helped guide me through my decision. I wasn't getting one pulled over on me, and I knew it when I came to this office. It was really important to Dr. Garlich to understand why I wanted the procedure. He wanted this to feel like this did. He made that very clear throughout the entire process by asking tons of questions about what I wanted and expected to come from the procedure. If what he could offer and what I wanted didn't line up, he wasn't going to move forward. Not only was Diane and Dr. Garlich and all of the nursing staff wonderful on the day of surgery, but the anesthesiologist who has worked with him for years came in and actually prayed over me prior to the surgery. That was probably the most impactful moment for me. Their level of patient care went way beyond getting through the operation. It went through my safety and well-being as well. After the operation was finished, I was surprised at how easy my recovery was. Prior to surgery, Dr. Garlich gave me some vitamins that would help swelling and bruising, and it sure did. The more important thing to me was, when can I go back to activity and be with my kids? I was back at the gym 10 days later after surgery. The only thing I couldn't do was something that would hit my nose or possibly cause injury to the surgery that he had just performed, but other than that, I was right back at it. What I would say to someone who's thinking about having this procedure, it's a lot more than the way you look when you come out. You want to know that your best interest was put at the forefront of the decision-making process the entire time, and that's definitely how I felt here.
At the end of the day, when my patients are done, what I want them to experience is to no longer worry about the worries that they came in with, be it cosmetic or be it functional. I think once they've gotten past that, then they truly are able to relax, be comfortable, and express that inner beauty.